Indian health officials have found that not everyone who's recovered from COVID-19 will develop antibodies. A serological survey conducted in New Delhi shows 97 out of 208 people previously infected with the virus are without antibodies. For more on what this means, let's join up with Ishan Garg for more on this. Ishan, this latest serological finding, does having no antibodies mean that patients did not develop immunity to the coronavirus?
Well, first of all, Steve, we need to look at the sample size that was collected for this particular survey. So that can be divided broadly into three categories. First of all, people who never contracted the virus. Secondly, who did contract the virus but developed very mild symptoms. And thirdly, we've got the group of people who contracted the virus and developed severe response to COVID-19. And now many experts believe that it's actually the people who showed very mild symptoms or actually no symptoms. Those were the people in majority. So one of the foremost reasons why antibodies don't show up in serological surveys is because the concentration of the antibodies could be so low that it does not actually show up on a blood smear test. Now, there are about half a dozen different reasons why they might not show up on a serological survey. But speaking to experts, from what I've gathered, is that people should not be concerned at this point that if they're not developing immunity.
So the significance of this finding is, first, is not to be alarmed or panic because the antibodies have disappeared. It's a natural thing in any infection. Antibodies decline after the infection fades away. But there are other cells like B and T cells which have the memory of the virus and they can produce the antibodies when required.
And we were speaking earlier to Ishan Garg in New Delhi.